Did you know that up to 50% of seniors may have low vitamin D levels without even realizing it? This sunshine vitamin is essential for strong bones, a healthy immune system, and muscle strength. Yet, many older adults mistake its symptoms for normal aging, leading to fatigue, joint pain, and even higher fall risk. The good news? Recognizing the early signs can help you take action quickly. If you care about your health after 60, this is a video you'll want to watch until the end. Vitamin D plays a crucial role in maintaining bone density, muscle function, and overall immunity, especially for people over 60. As we age, our skin produces less vitamin D from sunlight, and our diet often doesn't provide enough to compensate. This deficiency can increase the risk of fractures, slow wound healing, and weaken the immune response, making seniors more vulnerable to infections. Understanding the warning signs is not only important for preventing long-term complications but also for improving daily energy and mobility. Addressing vitamin D deficiency early can make a significant difference in quality of life. Feeling constantly tired, even after getting enough rest, is often brushed off as a normal part of aging. However, a growing body of research suggests that vitamin D deficiency may significantly contribute to chronic fatigue among seniors. Vitamin D supports the production of adenosine triphosphate, ATP, the molecule responsible for cellular energy. When levels of vitamin D drop, energy production slows, making even simple daily tasks feel exhausting. In addition, low vitamin D may indirectly affect mood by disrupting neurotransmitters like serotonin, which are linked to motivation and mental alertness. This means the fatigue you feel could be both physical and emotional, making it harder to stay active or socially engaged. A senior who once enjoyed morning walks may suddenly feel drained, even after a short stroll, without understanding why. Some studies have shown that correcting vitamin D deficiency, either through diet, moderate sun exposure, or supplements, may improve energy levels within weeks. It's also worth noting that fatigue caused by vitamin D deficiency often comes with other symptoms like muscle weakness or bone discomfort. If you find yourself feeling worn out for no clear reason, it's a strong sign to consult your healthcare provider for a simple blood test. Vitamin D is essential for calcium absorption, which keeps bones strong and resilient. When vitamin D levels are too low, calcium absorption decreases, leading to weaker bones and a higher risk of fractures. For many seniors, this deficiency first shows up as persistent bone or joint pain, often mistaken for arthritis or general aging discomfort. Research suggests that insufficient vitamin D can cause osteomalacia, a condition where bones become soft and painful. Seniors may notice this pain in the lower back, hips, or knees, especially when standing up or walking. Over time, this can affect balance and increase the risk of falls, which is particularly dangerous for older adults. Another subtle symptom is joint stiffness in the morning or after periods of inactivity. While this stiffness can be caused by other conditions, vitamin D deficiency can make the sensation worse because the muscles and bones lack the necessary support to stay strong and flexible. The good news? Studies show that restoring vitamin D levels may reduce these aches and pains. A combination of proper diet, like fatty fish, fortified dairy, or egg yolks, safe sun exposure, and supplements under medical advice can significantly improve bone health. If you find yourself catching colds or infections more often than before, it could be more than just bad luck. Vitamin D plays a vital role in supporting the immune system by activating key defense cells such as T cells and macrophages. Without enough vitamin D, these cells cannot properly identify and fight harmful viruses and bacteria. Studies have shown that seniors with low vitamin D levels are more susceptible to respiratory infections like influenza or pneumonia, both of which can be dangerous in older age. This deficiency may also cause slower recovery times, meaning that even a simple cold can linger for weeks, leaving you feeling run down. Low vitamin D also affects the production of antimicrobial peptides, natural compounds in the body that act as the first line of defense against pathogens. Without sufficient levels, your immune system may not respond quickly enough to stop infections in their early stages. Another subtle sign is recurring urinary tract infections, UTIs, or slow-healing wounds, which may point to weakened immunity. Experts believe that raising vitamin D levels to optimal ranges can enhance immune resilience, especially during colder months when sunlight exposure is limited. Simple steps like spending 15 to 20 minutes in the morning sun, consuming foods like salmon, mushrooms, or fortified milk, and taking doctor-approved supplements can make a noticeable difference. Seniors who improve their vitamin D intake often report fewer sick days and a stronger sense of overall well-being. Muscle weakness is one of the most underestimated effects of vitamin D deficiency in seniors. While we often associate weak muscles with just getting older, the truth is that low vitamin D plays a major role in reducing muscle strength and coordination. This vitamin is not only essential for bone health but also for maintaining the function of muscle fibers, especially the fast-twitch fibers responsible for balance and quick movements. When these fibers weaken, everyday tasks like standing from a chair or climbing stairs can become unexpectedly difficult. Vitamin D helps muscles contract properly by regulating calcium and phosphate levels, which are essential for muscle activity. Without it, muscles may feel sluggish, leading to a noticeable loss of stamina and agility. Seniors with low vitamin D often describe feeling heavier or slower, even if their weight hasn't changed. This subtle change can greatly increase the risk of falls, which are a leading cause of injury among older adults. Studies have shown that seniors with optimal vitamin D levels have better muscle strength, improved coordination, and faster reflexes compared to those with a deficiency. For example, research published in medical journals highlights that vitamin D supplementation, combined with light physical activity, can significantly improve muscle tone within just a few months. Another sign of deficiency is frequent muscle cramps or a burning sensation in the thighs or shoulders. These symptoms can make daily activities such as lifting groceries, gardening, or walking long distances much harder. If left untreated, the gradual weakening of muscles can lead to reduced independence and a decline in overall quality of life. To counter this, experts recommend safe sun exposure, consuming vitamin D-rich foods like tuna, salmon, and fortified cereals, and incorporating gentle strength exercises such as chair squats, wall push-ups, or resistance band workouts. When guided by a healthcare professional, vitamin D supplements can also help restore muscle performance and prevent falls. Vitamin D isn't just about strong bones and a healthy immune system, it also plays an important role in how we feel emotionally. Often called the sunshine vitamin, it influences the production of serotonin, a key neurotransmitter that stabilizes mood and creates a sense of well-being. Low vitamin D levels can lead to subtle but significant mood changes, ranging from irritability and restlessness to more serious issues like depression. Many seniors report feeling down during colder months, especially when sunlight exposure is limited. This condition, known as seasonal affective disorder, SAD, is linked to a drop in vitamin D production due to less sun exposure. If you've noticed that you feel more sluggish, sad, or unmotivated during the winter, low vitamin D may be one of the causes. This deficiency doesn't just affect mood, it can also influence mental clarity and cognitive performance. Research suggests that low vitamin D is associated with an increased risk of memory problems and slower thinking. A senior who was once sharp and alert might feel more easily confused or forgetful, which can impact daily confidence and independence. The encouraging news is that studies show vitamin D supplementation and safe sun exposure may help improve mood and mental alertness over time. Simple steps like spending 15 minutes in gentle morning sunlight, adding foods like salmon and fortified milk, or following a doctor's advice on supplements can make a noticeable difference. It's important to remember that while vitamin D can support emotional health, persistent or severe mood changes should be discussed with a healthcare professional. Your mental well-being is just as crucial as physical health, and taking small steps to maintain optimal vitamin D levels may help you stay positive, focused, and resilient as you age. Health tips: how to improve vitamin D levels safely. Enjoy morning sunlight. Spend 15 to 20 minutes outdoors during the early morning when sunlight is gentle. This helps your body naturally produce vitamin D without the harmful effects of harsh UV rays. Eat vitamin D-rich foods. Include fatty fish like salmon, mackerel, and sardines, along with egg yolks, fortified dairy products, and mushrooms to boost your intake naturally. Stay active. Light exercises such as walking, yoga, or gentle stretching can improve bone health and muscle strength, which work hand in hand with vitamin D. Check your levels regularly. A simple blood test can determine if you need extra supplementation. Always consult your doctor before starting any vitamin D supplements. Combine vitamin D with calcium for better bone support. Ensure your diet includes calcium-rich foods, as vitamin D helps your body absorb calcium more efficiently. These small, consistent habits can make a big difference in your overall health, helping you maintain energy, mobility, and mental sharpness as you age. If you found these insights helpful, consider taking a moment to reflect on your own health habits. Have you noticed any of these warning signs of vitamin D deficiency in your life? Share your experiences in the comments. We'd love to hear your story. Don't forget to like this video, subscribe to our channel, and hit the notification bell so you won't miss our future tips on healthy living after 60. Together, we can build a stronger, healthier community of seniors around the world.